Hello, my name is Dr. Dawn Ewing. This is part 5 of our series, Biological Hygiene. In this particular module, we're going to talk about testing dental materials and about detoxifying heavy metals. What kinds of tests are available to test the materials we talked about in the last module? Well, there's blood serum compatibility, and there's applied kinesiology, and there's electrodermal screening, also known as EAV or CEDS or MSA. So who should have compatibility of dental materials done? Well, the immune-compromised patient for sure, but I'm going to say most everyone. Those that are looking to reduce burdens and to improve their own health. Blood serum compatibility is used when you're looking for extreme allergic reactions. You have exposure to the substance. It's only for a few seconds. That's all that's needed. The dental materials may react after longer exposure times. The downside to using blood serum compatibility is you must have been exposed to that material before, because we're actually looking for antibodies. Applied kinesiology is a good way to check the body's response to a substance in the person's energy field. It's quick and inexpensive. You must have this particular substance available to be able to challenge the individual. The downside is you get only a yes or a no. Electrodermal screening can fine-tune those yeses and nos because you actually end up with numbers. So we know if something is really okay for the person or something is really not okay. Let's take the example of a watch stopping. If my watch stopped because I put it on, am I actually allergic to it? But if I take it off and it starts ticking, what's going on? Well, there are certain things that create energetic mismatches. For me, I have a particular piece of jewelry that when I wear it, I love it because it's beautiful, but it doesn't make me feel very good. So the moment I come home, I'm inclined to take it off right away. I'm not allergic to it, but it's an energetic mismatch. Does the person become compatible with things later? Yes, oftentimes. As the burden of mercury is lifted and candida is addressed, the person can become tolerant of things that they couldn't handle in the beginning. All kinds of things can have energetic effects on you and make you sick. The environment, people, but dental work is different. You can't get away from it. It's a 24-hour-a-day exposure. Remember, there's nothing as good as what God gave you. How do I know my patient has possible heavy metal toxicities? A hair analysis only shows what the body is excreting, if it can excrete it. A lot of people show up with low levels of heavy metals in their hair, which only means it's locked in the body tissue. A BTA or a QFA, biological terrain or a quantitative fluid analysis, might give you some clues. If you're using meridian stress assessment, the joint, nerve, or fatty degeneration points might give you some clues. Heavy metals in the body cause electricity to move faster, so you may see faster and higher rises when using those pieces of electrical equipment. You could do a urine heavy metal challenge or a tri-test using hair, urine, and blood. Can I send my patient out for a urine challenge just right away? No. You want to wait because you always want to be safe. You need a biological dentist in the picture. Dr. Jordan Davis, who's an MD, Toxic Studies Institute in Boca Raton, said walking into an average dental office can result in a mercury exposure that's approximately equivalent to having 19 amalgam fillings. Did you know that in the state of California they're required to have a placard in the waiting room? That if you're a pregnant woman, you're being exposed to higher levels than what OSHA would deem safe for a pregnant woman. So it's not the ideal place for you to be. Can my regular dentist do it? Well, they may not have the proper equipment or training. Be an educated consumer. Ask questions. Go to our website at IABDM.org and look for questions to ask a biological dental office, and we also give you the answers you would like to hear. It does require special training and equipment to reduce the dangerous mercury exposure. These vapors go directly into tissues and are stored. A brain is a terrible thing to waste. Should they start having their amalgams removed right away? No, not yet. They may have the dental exam to start evaluating what needs to be done and what materials can be used, but they need to look at the sequential removal based on the current readings that are there. But no, we don't want to take the amalgams out yet. You want to prep the person for mercury removal. This means that they're going to see a physician that will network with the biological dentist. They'll check the excretory routes. Maybe they'll look at blood work to make sure that the bilirubin's not too high. They may use some homeopathic drainage remedies. They might discuss the detoxing afterwards using either EDTA or DMPS or DMSA or IVs of vitamin C, ultra-clear, homeopathics, herbals. You may end up having the patient rinse with chlorella at the appointment. Taking mercury out of a person's mouth does not mean it's out of the body. It just stops a source. So what if they can't afford to remove the mercury now? Well, here's the analogy I like to use. We want to stop the source. Here you see a sink that's about to overflow. And so the patient's going to scream, "Hey, Dawn, the water's about to overflow." If I simply turn the faucet off, that's stopping the source. That's removing the mercury from the body. By pulling the plug, that's opening the excretory routes, which we call chelation, the act of binding to the heavy metal and excreting it out of the body. So in opening the excretory routes, we're looking at things like the kidneys, the liver, the lymphatics, the large intestine, and the lung. Trying to detox someone without these excretory routes being open is like cleaning a room and not having a door or window open to throw out the garbage. Yes, it moved, but it's still in the room. Mobilizing versus detoxing. Mobilizing is what we just talked about. If we're cleaning a room, we can mobilize everything into a central environment, but it can lead to excretion or redistribution, especially in people who have MTHFR, where their body doesn't really methylate correctly. So we mobilize it out of one cell into the extracellular space only to be picked up by another cell. Detoxing is mobilizing and excreting. So what about a urine challenge now? I'm getting antsy. I want to verify that my patient has heavy metal toxicity. Can I do it? Can I do it now? No, not yet. You gotta wait. Check for reactions to heavy metals. Having a higher reactivity to a heavy metal can overwhelm the sympathetic nervous system. You may have to desensitize these individuals to reactive metals. Continue to monitor during the chelation process. You want to do it right. Now that you have the excretory routes open and the reactivities eliminated, now you can go for the challenge. There are several different substances that could be used to provoke heavy metals. You could try the test, which uses hair, urine, and blood to look for heavy metals in the body. The preference is the provoked challenge, which means that you could collect 6 to 24 hours worth of urine and you might not find very much in the body. But when you use a provoking agent, it's like challenging all the cells, like saying this is a stick up. If you have heavy metals, dump it. And then you collect the 6 to 24 hours after being given that provoking agent like DMPS or DMSA or EDTA, and you will see lots of mercury and heavy metals moved out of the body. Here's an example. We have someone who has a pre-DMPS, and you see that the urine is relatively low in mercury. And this is after a provoked test is done. And you see that it's really high in mercury. Then this individual goes through multiple chelations in order to mercury down. And you see that the mercury is coming down after doing several rounds of chelation. Here we have a fecal test before on top, where you don't see much being excreted. And on the bottom, you see the post-provocative using metal-free, which is a homeopathic remedy that combines with metals and escorts it out. And this particular test is a stool test done through doctor's data. What about a hair analysis? Well, it's great for most heavy metals. Finding mercury on the test can be challenging because if they have MTHFR or other reasons they don't methylate, it won't show up on the hair test. High silver could be silver water filter, or it could be that they take colloidal silver or nanosilvers. High calcium is a marker, though, that the body is acid from mercury and it displaces the calcium from the bones. So that's a clue that there could be mercury there. Here we see a hair test, a traditional hair test, looking at high and low levels. You'll note that the mercury is high in this test, which is a marker that lets us know this person is a good excreter of mercury. When we're talking about amalgam removal, and we're talking about safe amalgam removal, we want to make sure that a rubber dam is in place for the removal. Now, I'm going to remind you that that doesn't prevent the mercury vapor from going through the rubber dam, so you have to have a high-speed suction on the other side. You want to make sure that you are quartering the filling and removing it in a chunking technique of the largest chunks possible. Do have the patient rinse frequently with maybe a chlorella or charcoal rinse. And the patient wants to have an oxygen mask on during the removal to make sure that they're not breathing the mercury vapor as it's being created from the drilling process. We want to consider something like a 21-day immune cycle. The day of your first mercury removal is a big day. You could write it down. The white blood cells will undergo a sudden die-off 7 days from that day, and again on 14 days, with the largest being on the 21st day. So we want to avoid making appointments for the dental on the same day as the cycle lands. Don't do large quantities of oral vitamin C immediately before the dental work. Now, this doesn't take into consideration something like a lipospheric vitamin C. We're talking about just regular vitamin C here because it could cause loose bowels. Hopefully, I don't have to explain that any further. But large doses of vitamin C in the traditional kind can interfere with anesthetics, reducing their duration or even preventing the intended numbing effect. Do move the bowels. We want to prevent reabsorption during the process of removing mercury from the body. The patient might even choose to use colonics if needed. A good probiotic might be encouraged, or increasing fiber intake. The use of minerals might be used. A good macro mineral or an electrolyte replacement, possibly calcium, potassium, magnesium, or sodium. This is something for the primary care or the person who's chelating this patient to deal with. You know, mercury is a highly reactive free radical generator. It decreases the stores of sulfur required for detoxing. Mercury destroys the antioxidant enzyme systems that protect us against oxidosis. We want to protect the body. Increased mercury will decrease glutathione, which will reduce the efficiency of vitamins E and C. So sometimes a physician will use a glutathione IV or give the person glutathione orally. We might need to use it with E and C during the detox process. So, the patient's excretory routes are open, allergies are cleared, they're on minerals and antioxidants, and the mercury fillings are out. So can they do chelation now? It appears that some people become overwhelmed with symptoms when the mercury is in the extracellular space. Anything, a lot of things, can move the mercury from the intracellular space to the extracellular space. These individuals that have MTHFR are usually the ones that will complain bitterly. So you might use chlorella to clean it up before dumping it into those spaces so that the person doesn't complain as much, and you want to make sure that you've got enough drainage on board. Again, this is why you don't do it through a dental office. You let the physician and the primary care deal with this individual for this. Chelation, here we come. Remember that heavy metals can pocket in certain areas. By this I mean in an effort to store it someplace, there may be a cavitation site where heavy metals are hiding, or it may be centered in an area like the kidneys or the brain. Those are other good storage places, and the person will have to use homeopathic remedies to try to force it out of those areas. Ways to chelate. The term chelation actually means to claw to. In this instance, we mean to bind. You can use DMSA or EDTA or DMPS, something like metal-free, or you can use the IMD. There are so many different ways to chelate than there were 25 years ago when this was first started. There are homeopathics and nutraceuticals. You can use far infrared saunas. You can use ozone. You could use foot pads, foot baths. There are even bentonite clay foot baths that you can use that will all help facilitate moving the heavy metals out of the body. Now that they're chelating, you want to keep monitoring those excretory routes. Chelating is a lot of work for the body, and there are times when a break may be needed to work on those organs that are being taxed, specifically the kidney. Support the patient's needs. Removing the amalgams and the dental foci along with the chelation process is a very expensive proposition and emotionally draining for the patient and the family. Driving to and from appointments, coordinating visits, coupled with not feeling well, your essential oils and flower remedies may work to ease the stress for all involved. Cleaning out different pockets. Cavitations, which we talked about earlier, might have to be surgically addressed. Any other story you hear about this is just not true. These are areas of dead bone with no blood flow, holding toxins. I ask you, if you had a garbage can filled with feces, wouldn't it smell? Wouldn't you have to empty it and clean it out to get rid of all that waste and smell? Sometimes these pockets of dead bone are so overwhelming for the individual's immune system and really need to be dealt with. When not to remove mercury. Well, it's pretty obvious to me, if the dentist is not trained in the proper protocols, probably not the time to remove mercury, at least not safely. When a woman is pregnant, it's not ideal time for you to have mercury removal done. When a woman is breastfeeding, I usually encourage the woman to pump for a few days before the dental appointment and at least the day of and the day after dump what breast milk she has and use the breast milk that she saved. It's called the pump and dump method. I'd like you to email me if you've found any value in this particular series. Tell me what you'd like to learn. Give me some feedback on what you have been learning. And I hope to see you soon. Thank you.